Hi, hello everybody. Good morning. I'm Dr. Zoe McMillen here at Lifescape, one of the concierge physicians. Happy Friday to everybody. We are a little off schedule, but what we're talking about today was in the article that came out in late June. Before we dive into that, I will give a little quick update about some of the things happening in our community with COVID, etc. Currently in Arizona, we are at about 500 new cases a day of COVID-19, and that is a lot lower than when it was, 3,000 or more a day. So much better. Still, would be lovely if it was a lot lower / none. About 50% of Arizonans are vaccinated. And when you break that down into groups of age groups, about 44% of those who are 20 to 34-year-olds and 88% of those who are 65 or older. And then I actually tried calculating the positivity, and remember, if you think back, like the percent positivity was often used as an indicator of how we're doing as a society, and that is the number of positive COVID tests based on the number of total tests done in a day. So it's about 4% a day at this point, which is much better than many months ago. It was more than 10%, which was terrible. So trending in the right direction. Better would be if it was like 0.5%, but hopefully we'll get there. You maybe have heard about this new variant, the Delta variant. It originated in India. There have been multiple variants from all over, and the virus, as it replicates in your body, tends to mutate, and then of course it's often luck of the draw which mutation is then beneficial for the virus and often not beneficial for us. We are seeing a reduction in the neutralization of, with the monoclonal antibody treatments that had now been more widely available. It doesn't seem to work quite as well. And also maybe the vaccine, the neutralization properties don't work quite as well. Now, to be clear though, the vaccine seems to protect against death completely. It may not protect completely against mild illness. So if you are vaccinated, there's a very good chance you would not get the Delta variant COVID-19 symptoms, but you may get a mild case potentially. Yesterday, it was over the news. You may have seen that Pfizer, BioNTech are now recommending, from their standpoint, that there be a third shot or a booster shot. They studied giving the third shot 6 months after people had completed their second shot, and they saw 5 to 10 times higher neutralization titers. They also said that with real-world evidence from Israel, it showed that there was a decrease in efficacy about 6 months after full vaccination. The CDC and FDA are not recommending a booster shot at this time, and they're instead still encouraging people who are not vaccinated to go ahead and please get vaccinated. And overall in the United States, vaccination is at less than 50% still. And with regard specifically to the Delta variant, Pfizer is working on a booster that is going to include this variant, and they plan on doing clinical trials in August. The Delta variant does seem a lot more infectious, much higher viral particles in somebody, so very easily transmissible. And we, bottom line, if you can get vaccinated, recommend it. You will help society as well by helping us get more towards that herd immunity and not being one of the people who get infected, hopefully, and then could spread it to others who maybe don't fare as well. And that's about it for the COVID update. Getting into my topic, I focused on 5 steps to optimize your doctor's visit, and this is geared more at when you're seeing a specialist or somebody else. When you're seeing one of your Lifescape providers, we are giving you the time. We are helping you navigate the healthcare system. We're not bound by insurance models which dictate that you need to have, tons of very short 15-minute visits. Ours are at least double, or if not more, and you have access to us all the time. So this is more when you're going to see the cardiologist or the neurologist or whoever we are recommending you see. This may help to make your visit more satisfying for you. So, one of the easiest things you can do is create some sort of digital list of your past medical history, your vaccinations, maybe your medications, your supplements. Those medications and supplements are probably one of the most important, with doses, so that it's easy for people to just get that information, and then update it as your meds change or your supplements change, and bring it to your doctor's visit. Even with us, if you've changed a supplement and on your own, or someone else had recommended it, let us know so that we can update it in your chart as well. Also, bring our contact details to their office. Even though we've often referred you, sometimes things get lost in the system, and then the specialist doesn't remember, oh yeah, it was Dr. McMillen who, referred me on, and you must send her a note, But giving that, either our business card or our information will help just remind people that we've referred to them. And they'll send us the note, hopefully. I also recommend writing a list of issues that you'd like to discuss, ordered from what do you really need to address that visit? What is bothering you the most? To, maybe something that you're like, this is just a question I had and want to know. And I promise that everybody, does this. I do it too when I go to a doctor, because I know that when I'm in the moment, I may forget something or, get off course. Also, when you're in the visit, don't be afraid to just write down little keywords or phrases. If you're getting told information about a new diagnosis or a new medication or a new treatment, you may want to just write it down, because later you might be like, oh, I thought I'd remember that, but we're all human, and it's a new word, it's a new thing, and you're trying to process all that information at the visit. Another thing is, if you can or want, bring a family member. I know with COVID, doctor's offices were restricting to one person. I think most now are allowing a family member or friend to come with, and especially if it's an emotional topic, or something where there's a lot of fear involved, bring someone with you, because they're going to listen for you and they're going to be your support person during the visit. Also, don't be afraid to circle back. If you've asked a question and you kind of feel like the doctor didn't really answer it, say, hey, I'm not quite sure again. Can you go over that? I don't know what the answer really is. And hopefully they'll define it a little better. Some additional things are, when you're seeing a specialist or any doctor, summarize what's happened in the interim since your last visit. Like for the cardiologist, I had this run of palpitations, 3 weeks ago, and, just kind of give a little update so that they know what's happened since they last saw you. Another thing to try and do is, if you know that you have multiple complex issues that want to be discussed, you can ask the doctor, how long do you have with me today? If they say, a short time, or, then you can try and say, okay, well, maybe I've got to make another appointment for sooner to discuss some other issues if we don't have time to address that. Or, if they say we've got as much time as you need, then, take that as it is, and you can go through all the issues you have. And also be honest with doctors about what you're experiencing. People often are naturally embarrassed to tell us about certain things, but trust me, your doctor's heard it all. So be it from, genital issues, whatever it is, tell us what's going on. We want to know, and that's the only way we can help. And yes, basically with the doctor jargon, if we happen to fall into that trap of using terms that are completely unknown, not English, just say, hey, can you rephrase that in a different way? And then with medications, if you are being prescribed a new medication, Ask about the common side effects or what you should watch out for or what you should expect. Would you expect to feel better with it in whatever time frame? So get a little information and how they're prescribing it, what dose and how often to take it. Just in case the pharmacy got a prescription with a different thing, you would be able to say, no, Dr. So-and-so said it was twice a day, and you could, confirm before taking it and potentially avoid, taking the incorrect dose or something. And that's just, an extra step of covering your bases. Most times, of course, the prescription is going to go through correctly. If you are recommended to get a surgery or some sort of procedure, again, ask details about it. Ask what the alternatives are, what the risks are, what the benefits are likely to be. And if you go ahead with it, Dr. Wilder has created a wonderful program to optimize your health pre-surgery. I actually did it myself, and really I found benefit in doing it, and I'm a physician. So I would recommend you looking into that. She has a book and also a webinar video series as well. And that's pretty much it for all the tips I have to offer. I think these little things can really help you have a more satisfying doctor's visit where you feel like you got your questions answered and some of the issues addressed in a good way. So I hope you have a good weekend and are staying hydrated in this heat. All right, take care, everybody. Bye-bye.